So good evening, everyone. Once again, welcome all of you, everybody present here from around the world. It's great that all of us are present here, and welcome to this highly anticipated webinar, and welcome on the behalf of IVSA India as well. I am extremely delighted to stand before you today as we embark on a journey of knowledge and sharing this collaboration. My name is Vaishali Raman, and I am a part of IVSA India. I'm the Animal Welfare Head for IVSA India. And for today's webinar, the topic of our webinar is Rabies and Operationalizing One Health. And we have this webinar in alliance with GARC, which is the Global Alliance for Rabies Control. As we all know, I'm sure as most of us know, that rabies is one of the deadliest disease that is shared by human and animals today. And I feel like today we are here to understand it more, understand it better. And we are also here to understand about One Health and what it is. So just a few words on what One Health is, or what I understand of it, is that One Health is a concept that recognizes the interconnectedness of human health, animal health, and the health of the environment. It emphasizes the interdependence between humans, animals, and the ecosystem that we inhabit. The goal of One Health approach is to promote collaborative and integrated disciplines, including human medicine, veterinary medicine, environmental science, and other fields. So let's address these challenges that affect all the three domains. So just to inform you guys about some of the webinar instructions, if anybody has any questions, please put it in the question box and not on the chat box. And if you guys want, you are more than welcome to introduce yourselves in the chat. That would be a cool icebreaker. And please do not unmute during the webinar. That is a request. And after every speaker has presented their presentation, there will be a short question and answer session. So and you can put it in the question and answers box during that time. So just to inform you about the flow of the event, there will be two presentations by each speaker, and after the presentations and the question and answer sessions are over, with the essay competition will be discussed by both the speakers. So that was all that I had to say about introducing today's webinar. And now let's proceed to the introduction of the first speaker. And I'm very grateful to introduce to you Ms. Mohana Marathe. So she is the president of IVSA India. Ms. Mohana Marathe is our beloved national president of the International Veterinary Students Association India. She is the fourth-year student of BVSC and AH at Mumbai Veterinary College in Maharashtra. She has been an active member of IVSA since 2020 in her first year, and her contributions towards the national member organizations are numerous. In becoming an ardent face of the association for the new member population and external partners, and innovating new initiatives to benefit the students. She has been instrumental in uniting and inspiring the diverse vet students of India this year as president. In IVSA Global, Mohana has been a member of the IVSA Standing Committee on Veterinary Education for 3 years. In 2020, she published 2 IVSA research surveys titled Pandemic Veterinary Education and Emergency Online Learning, and Hands-on Training and Practical Exposure in Veterinary Curriculums. As COVI's policy officer, in this year's work with its international partners like PLUMS, Purina Institute, Vetlexicon, and Royal Canin as the external relations officer. Notably, Mohana Marathe is this year's IVSA Excellence Awardee at the 72nd Symposium in Slovenia. On the subject of One Health, she strongly advocates for its undeniable importance and believes that global involvement and collaboration is an essential outside the classroom learning for the young veterinary professionals. Welcome, Mohana.
Hello, everyone. Thank you so much, Toshali, for that beautiful introduction. I'm really humbled to hear such kind words by my members. Hi, everyone. I hope you're doing good. I will just present my screen so that we can begin the event. And I see that, yes, we're now on sharing mode. So, okay, just one moment. Okay. All right, we're good to go. Okay, so once again, hello everyone. Welcome to the webinar. I am very humbled and grateful to get this opportunity to this time come on the platform as a speaker and not just behind the scenes, and to talk to all my fellow members and all the other IVSA members around the world and share my opinion on One Health and Rabies on behalf of IVSA India. So this is my presentation for today on behalf of IVSA India. And as we know, the topic of today's webinar is Rabies and Operationalizing One Health, which I'm very looking forward to all the following discussions. And in preparing this presentation, I found a really fun quote which I had to incorporate, which is public health is the adventure between health for all and all for health. And this runs perfectly with the theme for the World Rabies Day of 2023, which is all for one and one health for all. So without further ado, proceeding into the contents of my presentation, I will be talking about 4 subtopics today. Firstly, about IVSA India and our organization. Secondly, about our partnership with the GARC. Thirdly, I'll talk about rabies and its status in India. And then I will share the students' perspective on One Health, which is one very exciting segment on my presentation, thanks to IVSA India's efforts. Okay, so the first segment about IVSA India. So as many of you are members, I'm sure you'll be feeling the same amount of pride when we always present IVSA India to external partners and on a big platform. So presenting to everyone IVSA India, which is the Indian member organization of the International Veterinary Students Association Global. So this is the chapter for the national chapter actually for all the vet students of India to get together on a common platform for the sake of IVSA. So firstly, before going into IVSA India, I shall speak about IVSA Global, which is our parent organization. It proudly stands as the largest veterinary students non-profit association in the world, with 82 countries, 240 member organizations, and 40,000 members all around the world. The mission of IVSA Global is to benefit the animals and people of the world by harnessing the potential and dedication of veterinary students to promote the international application of veterinary skills, education, and knowledge. Global activities and events of IVSA Global include International Annual Congress and Symposia meets, the next one which is happening in Denmark in the end of July and August, the vet student exchanges to make the best use of this international platform for exposure, various standing committees with different agendas to function as a big organization with many agendas to work on for students, then national and local chapter formation, educational and vet industry partnerships, member awards, scholarships, and development aid grants for students, seminars, webinars, surveys, internship opportunities, competitions, projects, and many more wonderful opportunities are all available for the members of IVSA Global. Now about my beloved association, IVSA India. IVSA India is an international non-partisan, non-profit volunteer democratic organization of veterinary students in India under the parent organization IVSA Global. The IVSA India National Chapter was formed in August 2020 and has been one of the most reputed and enthusiastic IVSA MOs ever since. So the IVSA India family is extremely large and extremely tight-knit, I am blessed to say. So IVSA India has 20 pristine local chapters at different veterinary colleges in Indian cities all around the country. And in those 20 pristine local chapters, we have around 2,000 undergraduate veterinary student members as a part of our organization. And the list of IVSA India local chapters is shown in this list below. And we went from just a family of, I think, around 8 chapters in the first year, and then it is currently our third term of IVSA India, and we are very, very happy to share that we currently have 20 veterinary colleges on board, and always dream to expand into more colleges which don't have IVSA in India, and make as many friends and invite as many vet students to benefit from this mutual platform. Moving on about our partnership with the GARC. This is all about joining forces to work together for a common goal. So IVSA India and the GARC became official partners in March 2023. The Global Alliance for Rabies Control is a non-profit organization which seeks to prevent human deaths from rabies and relieve the burden of rabies in animal populations, especially dogs, through research, education, and policy support to raise awareness of this neglected disease. So this was the introduction of the amazing GARC, and we are very, very proud and happy to collaborate with them for this particular webinar event. And I also hope that we have a very mutual and strong bond for all the years to come. So yeah, this was our MOU. And yeah, this is when our partnership began in March. A sneak peek of the first post which went out. At the same time, besides IVSA India partnership, the GARC is also partnered with IVSA Global on an international level with the IVSA Standing Committee on One Health, or SCO. And these are the few missions of SCO as listed below. It is a standing committee in IVSA Global which consists of members from all over the world who are passionate about spreading the One Health message and creating more awareness and more projects for students and animals as well. To protect all the stakeholders in the One Health community. Okay, so the next topic is rabies status in India. This segment consists of scientific information about the deadly disease of rabies and its epidemiological facts in the country. Okay, so rabies or hydrophobia is a highly fatal zoonotic viral disease causing inflammation of the brain in all warm-blooded animals or mammals. And just a few important facts about rabies. I'm sure Terence is going to cover this disease in a lot more detail from the GARC, with just a few basic facts, which I'm sure everyone knows or must know if you don't yet. That the etiology of rabies is the Lyssa virus type 1. Mode of transmission of rabies is via the saliva of infected animals through bites, which is 95% of the cases, and scratches as well as licks. Incubation period of rabies is 20 to 90 days. There is no established treatment for the disease, and deaths in humans are 100% preventable by the easiest way of vaccinating dogs. Moving on to the pathogenesis of rabies disease. So it all starts when a human or any other warm-blooded mammal gets bitten by a rabid animal, and the bite causes inoculation of the virus in the living tissues of the host. Following that, there is replication of the virus in muscles at the site of the bite. The third stage is when the virus enters the peripheral nervous system and is transported along it, following which the central nervous system is infected through the spinal cord as the virus ascends up the spinal cord and infects the brain. following which there is a descending infection which takes place. From the brain, once it is infected, there are a lot of symptoms of classical rabies which are displayed, like ataxia, like frothing at the mouth, neurological incontinence, hydrophobia, all of that starts manifesting, as well as meningitis and a lot of localized lesions as well. And the descending infection is when the infection travels from the eyes to skin or other organs. And when it does so to the salivary gland, the virus manifests over there, and it propagates the disease even further when that particular infected animal bites another species. And so the cycle of rabies pathogenesis continues. My next slide is the status of rabies in India. And honestly, I was very, very shocked to read these particular facts. They are really staggering pieces of informational statistics, and I would like to share it with all of you just to highlight how important it is that we all start focusing on the elimination of rabies disease, since it is the year 2023. So firstly, India is endemic for rabies, accounting for 36% of the world's deaths. Rabies causes around 18,000 to 20,000 deaths every year. About 30 to 60% of reported cases and deaths in India occur in children under the age of 15, as bites that occur in children often go unrecognized and unreported. Finally, a person dies every 30 minutes somewhere in India due to rabies transmitted by a dog bite. The source of this information is the WHO, and the year is the current year, which is why it was so shocking for me to read, and honestly gave me goosebumps when I went through this information. And it just highlights how much we need stakeholders to collaborate with each other, and how a lot more work is really needed to be done, especially in the country of India amongst all the South Asian countries. So this is a pictorial representation of the incidence of human death from rabies. And as you can see, India is the most densely populated country for the incidence of rabies death. In this data is from the year 2004. And I'm sure the statistics would be a little better as of now. It was not available to find any data on the recent years, but that also signifies how much more work is there to be done in order to protect this very important public health aspect from humans as well as animals for the zoonotic disease. So moving on to the most exciting part of the presentation, at least for me and the team of IVSA India, is the students' perspective on One Health. So this section is about getting to know what real students think about One Health in order to start operationalizing it, which is in context to the topic of this webinar. So in order to correctly obtain the students' perspective on this particular topic, IVSA India conducted an Instagram survey to see what its members think about One Health. So we have a bunch of questions over here in which I'm sure all of you, or at least many of you, took the time to answer, and we are now presenting to you the results of the survey. At the same time, there are two disclaimers which we would like to put forward, that this questionnaire was only intended for the students of IVSA India, more correctly the veterinary students studying in India of BVSC and AH course, and also the results represent the views of the respondents and not the entire population. But nevertheless, we are very excited to share with you our first question regarding One Health, which is, do you perceive public health and epidemiology as a more theoretical subject in your BVSC and AH curriculum in India? So majority people have said that yes, they do think public health and epidemiology, or as we call it, BPE, is somewhat of a more theoretical subject than a practical subject, and the same amount of population also thinks that it's somewhere in between. But the minority is saying no regarding this question. Oh, also, the chat box is an interactive platform on this webinar, so I highly urge all of you to also put your thoughts in the chat box about what you think in this question, whether you agree with the census or you disagree with it, and what your opinions are, since there are a lot of questions which I will be showing you. So let's just make this part interactive. The second question is, how important do you think public health and epidemiology is as a subject? So looking at this answer, we were really pleased to see that so many people believe that public health is the most important, as in on a scale of 1 to 4, it is extremely important. And I think the future of One Health is in good hands, since all the students in India think that public health is a very important subject. The next question is, how much does your university prioritize the subject of One Health in your curriculum? So this particular question had some mixed answers. Majority was somewhat in between, I would say. But there's a lot of discrepancy from university to university across the country. But for these students, we also hope that you are able to do your own research about the particular topic or gather external help and support in case you are, since many of you do believe that public health is an important subject. So for public interest as well, it's always best to stay involved in matters beyond your college as well, and educate yourself as much as you can. The fourth question is, do you struggle with understanding what are the broader applications of One Health? And this was a huge majority. 50% students did agree that they struggle with understanding what are the broader applications of One Health, which is a very important question, I would say, because this is something I used to relate with as well before I actually had a conversation with Dr. Terence from GARC during planning this webinar. And that did answer a lot of questions for me regarding the applications and the scope of One Health, but I do completely relate with this. The fifth question, in your vet student life, how often have you seen different professions collaborating to protect One Health? And in this, a large population of students believe that sometimes they have seen students, seen different professions collaborating to protect One Health. This question basically means whether they have seen veterinarians, doctors, environmentalists, and a lot of different occupations getting together on one platform to protect public health in any sort of a public awareness, educational way, or organizing some camps and different activities to collaborate with each other's professions, which is one very important aspect of fighting the zoonotic diseases and various aspects like rabies, is for different professions to come together in order to do so and put their expertise, like pool their interests and think of the best strategies to deal with it. So in this, a very large number of students have agreed that they have seen this. In my case, I would say as it is a little rare for me to see, but I think there's a lot of scope for especially the younger generation. Since we are in IVSA, I know that there are a lot more organizations just like IVSA for medical students, for dentistry students, pharma students, and also environmentalists, and very different kinds of people studying different subjects related to the healthcare industry at our same age. So I definitely want this current generation and all of us to go into the future having this particular idea of One Health and collaborating with different professions at the back of our mind, and definitely try to use it in our profession as much as possible, to use our expertise to help as many people as we can, as rightly stated in our curriculum. So my next question is, do you think the collaborative efforts between different stakeholders like animal, human, and environmental health, as well as the government in our country, significantly less? So a large number of population has stated that it is less. They think in India, the collaborative efforts are comparatively less. And that is, again, something that I wish that the current generation can make an effort to change. Because there, as you can see in the results, there's a very great scope for improvement in this particular criteria. The second last question for my presentation is, do you try to stay up to date with One Health developments in fields outside veterinary health, like human health or the environment? So this is for all the veterinary students who, as a hobby, would like to research about topics or stay updated with the news which happens in other industries except for veterinary medicine. And this is a very, very important quality to have as a young professional, to stay updated and gather as much information and knowledge as you can from every corner of the world. Whatever is coming to you, you should definitely try to absorb that in your life and in your practice as well. So the results for this states that a large population of students agree that they sometimes try to do it, and also almost equally large population of students say that they do already do that, which are two very positive virtues to possess as a student in the current times. And the last question, as a part of our IVSA India survey for this particular webinar of Operationalizing One Health, was through what educational activities, awareness, or other initiatives can One Health be made simpler to understand? So these were the results which we got by the answers of all the wonderful students amongst you who took the time to answer questionnaire, and we got some very good responses in this as well. That the public bodies conducting informative webinars about One Health and providing insights on such concepts on a global level. Actually, if there are very large organizations conducting events which are open to all, that would be very beneficial for the public interest to learn. And by spreading awareness about One Health risks like emerging diseases or zoonotic diseases, vector-borne diseases, food safety, hygiene, etc., it is very important to know about the risks which are involved in One Health, just so we know what kind of a danger we are protecting humans and different living things from when it comes to zoonotic diseases. It is very important to be aware of the risk in order to think that it is an important topic and also something worth fighting for. Next, making informative resources available widely to different target populations. The internet has become a very great resource in studying for all of us equally in the current times, and also there are a bunch of very useful resources available. I would also like, in the same statement, give a shout out to the GRC. If you've not checked out their website, then you definitely should, because in their newsletter and in their website resources, they have a lot of information about the disease, about the spread, which is very useful to fellow veterinary students and also the public like us. Then coming to prioritization of the subject by schools and universities, as a part of one of the questions, this is a very important thing for students to be groomed in order to think that One Health is a very important subject from their fundamental years of becoming a doctor itself. And I visited a few very beautiful universities where this is a very important subject and where the students are very motivated to pursue this. But as we saw in the question, there are a lot of discrepancies in colleges around India, which it is time to start bringing that number higher. And yeah, we really hope that all schools and universities would start to prioritize the subject and conduct activities regularly, which brings people's attention to, again, the dangers of One Health and why we should protect it and what we can do as young veterinary doctors in the profession. Then proactive involvement of the government and different bodies of the government, and via active, what is that? Activism, sorry, activism and different things, especially since we are the professionals in this field, we should definitely try to bring the government's attention to this particular topic. And finally, more collaborations between stakeholders, organizing interactive activities with professionals from different health sectors to discuss strategies together, just like today's event where we are collaborating veterinary students and the great GARC Association. And I think a lot of different professions have also joined us in the attendees. So this kind of events, I'm sure, will go a very long way in protecting One Health and spreading awareness about the importance of this concept amongst all the students. So yeah, be sure to add any other suggestions you have about this question or any of them in the comments below. And thank you very much. That was my time. It was really fun to present all the answers to the questions which we used in our survey. And as I said, once again, it was lovely to get a chance to be a presenter in this webinar as IVSA president. And instead of working behind the scenes, it was really fun for me to get this opportunity. So I hope you enjoyed this. And we have a really amazing presentation after this by Dr. Terence from GARC. Do we have time for questions? I don't think we do, but if there are any other questions addressed to me, you may put it in the questions box in the webinar, as well as these are my credentials and also IVSA India's official email address in case you would like to get in contact if you don't have a local chapter in your college yet, if you would like to establish an IVSA in your college or any such related doubts to IVSA, feel free to reach out to us and my whole team will be very excited to get in touch with you. So thank you very much. That was my time, guys. I hope you enjoy the rest of the webinar and I will see you at the end.
Thank you, Mona, for that wonderful and informative presentation. Hello, everyone. My name is Ansh Modak. I am a second-year student at Bombay Veterinary College. I'm also part of the IVSA India Expo, currently serving as the interim social media head. I'm going to be your moderator for this part of the webinar. And without further ado, I'd like to introduce our next speaker for today, Dr. Terence Scott, who is the Director of Programs at the Global Alliance for Rabies Control, GARC. Terence's responsibilities primarily focus on coordination of World Rabies Day activities, the development of rabies epidemiological bulletin, and continued implementation of the stepwise approach towards rabies elimination tool, towards the development of national strategic plans. He is a member of the Marathon Regional Rabies Control Network Steering Committee and through such network provide technical in-country trainings and support to national governments and other stakeholders to assist efforts towards rabies elimination. It's great to have you on board today, Dr. Terence. I now hand over the platform to you. Thank you.
Thank you very much, Ansh, for that lovely introduction. And hello and welcome to all the participants at this webinar. So I'd like to thank you for taking your time, especially on a Saturday afternoon or morning. I'm not sure from around the world where you have joined, but I do see that there are people coming and joining from Africa, from Asia. So we've got participants from all around the world joining us, and I appreciate that. And thank you for taking the time. So today I'm going to be presenting on rabies and operationalizing One Health as part of this webinar, as the key topic behind this webinar. And so I'm going to be running through how rabies operationalizes One Health, giving you a little bit of background about rabies, just a very brief background, and then looking at also how rabies helps to strengthen health systems. So I think we've heard a lot about in the public media, in newspapers around the world, in terms of the Pandemic Prevention Fund that has come up after COVID and the issues around the delivery of essential biologicals to different countries, about the need to improve and strengthen health systems so that we can be better prepared for pandemics or other major disease outbreaks in the future. And I want to try to tie this into how rabies can address a lot of these challenges by addressing rabies itself, saving human lives and animal lives from this deadly disease, and then also helping to strengthen overall health systems. So just touching on the fantastic introduction from Mohana, just adding on a few basic points, just to reiterate some of the basics about rabies. It's a zoonotic disease, which I'm sure we all are aware that means it can be passed from animals to humans, and dogs are the primary reservoir of the disease. So 99% of human rabies cases around the world are as a result of bites from dogs or exposure to rabies from rabid dogs. And so this means that we need to focus on eliminating the disease in dogs to prevent human deaths from rabies. So the burden of the disease, as Mohana mentioned, she focused primarily on India, but looking at it at a global perspective, a person dies every 9 minutes from rabies worldwide. So that means by the end of this webinar, 10 people would have died from rabies, 3 of those from India, and 4 of those 10 people who would have died during this webinar would have been children under the age of 15. So these are based on estimates, but these are relatively reliable estimates that we have of the burden of the disease from around the world. So now we know that rabies is a deadly disease. We know that it affects more than 100 countries around the world. It's still endemic in more than 100 countries around the world. So can we actually eliminate the disease? Is it possible? And the answer is yes, the short answer. So going into a little bit more detail, we know that there are effective vaccines available. These are effective vaccines in both the human and animal populations. So this is a newspaper excerpt from the first child, Joseph Meister, who was vaccinated in 1885 with the vaccine that was developed by Louis Pasteur. This vaccine has come a long way, and now it is an extremely safe and effective vaccine that is extremely effective. So if you can get post-exposure prophylaxis before the onset of symptoms, you can prevent rabies in people. And we also know that rabies is 100% preventable in the animal population too, in dog populations. And this can be done through the vaccination of dogs because we have effective vaccines also. So we know how to beat the disease. We need to vaccinate dogs because they're the primary reservoir. They're responsible for the majority of human rabies deaths. We need to ensure timely care. So if you are exposed to a suspect or probable or a rabid animal, you need to go and seek treatment, make sure that you get the effective post-exposure prophylaxis, which includes wound washing, vaccine, and sometimes immunoglobulins. And then we also need to make sure that people are aware of the disease. So we've seen already that there are many people around the world, many of you maybe even on this webinar, who were not necessarily aware of the dangers of the disease, of the burden of the disease, and that it is still a problem maybe in your own country. And so we need to be aware of the situation. You need to be aware that you need to vaccinate your dog. You need to be aware that if you are exposed, you need to seek timely treatment. So we know that rabies is possible. Rabies elimination is possible, but we need to work together to achieve this. So we need to operationalize One Health. And that brings me to the focus of this webinar. So just touching again on what Mohana mentioned and what was introduced by Toshali at the beginning of this webinar, just touching on what is One Health? What actually are we talking about here? So One Health, the full definition, is a collaborative, multi-sectoral and transdisciplinary approach at all the different levels, so all the way from local to the global level, to achieve optimal health and well-being outcomes, recognizing the interconnections between people, animals, plants, and their shared environment. So this is a very detailed and complex definition, but in essence, it is considering and bringing together human, animal, and environmental health and ensuring that all of those things are interrelated and connected, and that we need to address all of this in a holistic manner. So you can see from this Venn diagram, there are many similar ones out there. One Health falls in the junction where human, animal, and environmental health all meet. So that's what we're speaking about when we talk about One Health, or the concept of One Health. And One Health seems fairly straightforward. It seems very simple. We need to make sure that, in general, people, animals, and the environment are healthy. And by doing that, we can address almost all diseases, all conditions, poverty, we can eradicate hunger. All of this can all be done through One Health. So what's the problem? Why is operationalizing One Health so difficult or so complex? Why hasn't all of this been done, and why aren't we living in this perfect world? So there are many challenges to operationalizing One Health, and I want to bring this to the example of a group project. So I'm sure every single person on this webinar has participated in a group project at some point, whether that's been at school, at their university or college, or even in their workplace. You've needed to work with different people together to achieve something. And working in these group projects can often be extremely difficult because you need to coordinate with a whole bunch of different people. Instead of you just taking control and you know exactly what you need to do, you need to now coordinate with multiple different people. And this is the same with One Health. Different ministries need to coordinate with one another, different organizations, different groups. There are also different priorities. So while your group topic at school may be focused on one particular thing, each different individual may have different ideas or different focus points as to what they would like to address in that project. And so there are different priorities. I'm more interested in one aspect while you may be interested in a different aspect. And so it's difficult to have a very clear and direct goal and vision when you are trying to operationalize One Health. Another challenge is the sharing of resources. So there's the management of different resources, the logistics to share it between different people. This becomes especially more challenging when you are looking at large organizations or ministries where there are formal processes and structures in place that allow for the distribution of resources within their own structure, within their own ministry, but it makes it more difficult when you now need to share resources with other ministries and allocate those or other organizations. And One Health also requires a longer term vision. So if you are looking at obtaining immediate results often, and again, looking at the group work example, often it's easier just to do it yourself. But now if you want to have a larger project with much wider objectives, much more impact, you need to have a longer term vision. So you need to have multiple different steps in the process, addressing each of the different needs to then achieve this overall concept. And that is the same again with One Health. And I'll touch on specific examples when I start linking this to One Health and Rabies. So moving on to then Rabies and One Health, and why I believe that Rabies is an excellent example to operationalize One Health. So what makes it such a good example of demonstrating One Health in action, of operationalizing One Health? So going back to this diagram, we then see that its environment, human and animal health are interlinked and interconnected, and we need to address this in a holistic manner. And if we start to associate all the different aspects associated with rabies control and elimination, we can start filling in all these different parts under the different health sort of aspects within One Health. So looking at environmental health, we know that there are geographic barriers, there's climate change. Human health, there's post-exposure prophylaxis and bite prevention. Animal health, there's dog vaccination. But then you also see that there are these circles that have two colors. So one for environmental and one for animal health, showing that there's a shared interaction. And we see that with rabies, there are actually a lot of shared interactions between all these different aspects. And so this shows just on face value, and this is just a few examples, on face value, how rabies can operationalize One Health, how we need that collaboration, how we need different departments and different organizations and ministries to work together to deliver effective and efficient rabies elimination programs. So I'm going to go into a little bit more detail, just pick out a few of these examples and explain it to you so that you have a better understanding of what I'm trying to convey to you. So looking at some of these key examples of operationalizing One Health through rabies, as I mentioned, we know that there is a human vaccine available. It is extremely effective. If you are exposed to the virus, you can go receive post-exposure prophylaxis, and if you receive post-exposure prophylaxis in time before the onset of symptoms, you will be safe from the disease. So this is a very effective way to prevent human rabies cases. However, taking one example from a study done in 2021, a publication in 2021, just one example of a country where there are very few human rabies deaths, so clearly something is being done correctly. There's a lot of work going into rabies elimination efforts, and there is a lot of progress because there are only 9 deaths annually from rabies. But we can also see here that that's very effective. So there's very, very few human rabies cases per 100,000. But we see here that the vaccination coverage in dogs is 0%. But the number of people per 100,000 receiving post-exposure prophylaxis is very, very high. So 37 for every 100,000 people. That's extremely high. And with this then comes a very, very high cost to the Ministry of Health. So unfortunately, while it is effective, this is not a very sustainable approach. So this country will need to continue providing human rabies prophylaxis forever, because they are not addressing the solution at the core. This is a reactionary approach, and it is not a preventative approach. And so we need to then ensure that we eliminate the disease. And we know that dog vaccination is the most cost-effective and practical means to eliminate the disease. To eliminate not only the disease in dogs, but also to eliminate human rabies, as we know that dogs are responsible for more than 99% of human rabies cases globally. So if we eliminate the disease by vaccinating dogs, we can prevent human rabies deaths from the disease. And so therefore, dog vaccination has a very clear benefit for human health. But we know that there is a disparity, there's a problem with the allocation of resources. And this is what I mentioned as one of the challenges towards operationalizing One Health. Because in many instances, the Ministry of Health will have far more funding than the Ministries of Agriculture, as an example. And so it would be ideal if the Ministry of Health could share funding, could share resources to support the Ministry of Agriculture in their dog vaccination efforts, because as we said, that has a very clear benefit for human health. And so you can see how we are starting to link together with the challenges associated with One Health in terms of sharing these resources, the logistics, the management of this. And ideally, we would see human health contributing resources to dog vaccination. And while this is challenging, we have some extremely good success stories. For example, in Latin America, the Pan American Health Organization has been driving efforts alongside the national governments to deliver effective dog vaccination campaigns. And this is where almost anyone becomes involved in a mass dog vaccination campaign, ranging from teachers to nurses to human health practitioners. Everyone gets involved, and those resources are shared so that there's a very strong focus on mass dog vaccination, which results in that clear benefit for human health. So it is possible. There are very good examples from rabies, and so we need to try to focus on this so that we can eliminate the disease globally. And looking at the impact of this, we see that there is a very clear impact. This is the black line is the number of human rabies deaths. The dark blue bars are the number of animals or the number of dogs vaccinated, and these light blue bars are post-exposure prophylaxis provided. And so we see a very clear trend as dog vaccination goes up, the human rabies deaths go down. Of course, that is supplemented with human post-exposure prophylaxis that is still essential, irrespective of whether you have dog vaccination or not. But even then, there are benefits. As the dog vaccination continues to increase, the number of post-exposure prophylaxis provided begins to decrease as human rabies deaths also decrease, until you hopefully eventually get to the elimination of the disease, first in humans and then in the dog population also. So we can see that very clear benefit between mass dog vaccination and the decrease in human rabies deaths. And this again brings that One Health impact into a very clear picture here. So just briefly touching on some other key or some other examples of operationalizing One Health through rabies. So responsible dog ownership is one of them. You may be thinking, how is this One Health associated? So we know that without responsible dog ownership, there are many free roaming animals in communities. These animals can become a menace. They can cause disturbances. They can bark. They can bite people. And they are also very difficult to vaccinate. They need additional resources to then catch these animals and vaccinate them. And so by having responsible dog ownership, we can reduce the number of free roaming animals on the streets and in the communities. And this can help us to ensure better human health, because if there are fewer free roaming animals in the communities, then there are fewer traffic accidents, as an example. People having vehicular accidents by hitting dogs that are roaming the streets. There will be fewer bite exposures because people have less chance to interact with unknown animals in their communities. And so there may be far fewer provoked and unprovoked bite cases in those communities. And also, by having responsible dog ownership, we can also improve tourism, potentially. In many instances, having a lot of free roaming dogs on the streets it has a negative perception and a negative impact on tourism. And so by addressing that, we're not only addressing maybe human health directly or animal health directly, we're addressing financial health, we're addressing the growth of the community overall. So you can see that it goes beyond simply the direct impact of human or animal or environmental health in terms of One Health. Another example is climate change. So you may be thinking, okay, climate change that affects everything, but how does it really affect rabies? Rabies is endemic around the world. But we see that as an example, there are some concerns regarding the movement of animals into new habitats because of global warming and the change in temperatures. And so there is a potential risk for vampire bats that are predominant in South America to then move into the USA. And with them, vampire bats also have rabies. And so they can bring rabies into the US through the vampire bat population. And so there are many different discussions and insights and investigations into the movement of species that can then, with them, bring other diseases, such as rabies, as one example. Now, looking at more than just the One Health aspect in terms of human, animal, and environmental health, we know that education plays a key role in everything that I've mentioned here. Everything that's highlighted is key. For education is key to that and to address that. So we know that community education is critical. We need to make sure that people understand that they need to prevent bites. If they are exposed to the disease, they need to seek treatment. They need to vaccinate their dogs. They need to be responsible dog owners. And so that already addresses many of the different aspects that I've mentioned. Your professionals need to understand how to educate other people. They need to be trained themselves in terms of not only maybe their specific aspects. If I'm a veterinarian, I need to understand, of course, animal health or rabies prevention methods associated with animal health, but I also need to understand the roles and responsibilities of my counterparts in the human health ministries. And then, of course, your stakeholders, so your politicians, your decision makers, your community leaders who need to help to drive the efforts through their own communities and through their own populace to make sure that they are aware that mass dog vaccination campaigns can come to those communities and to ensure that they have the resources and information necessary to drive rabies elimination efforts. And then beyond education and the whole One Health concept, in my opinion, surveillance is critical to absolutely all of this. And so we know that surveillance, especially One Health surveillance, is absolutely key to rabies control and elimination. We know that we need to have data sharing. So if you are the Human Health Ministry and you're tracking, for instance, bite cases or human rabies cases in particular areas, you need to have a good understanding of that so that you can identify hotspots where the disease is. But now you need to share that information with the the veterinarians, your animal health professionals, so that they can undertake strategic vaccination to target those particular areas where there are the hotspots, where there are all these cases occurring, so that you can break the cycle and eliminate the disease in those particular areas. And so it is absolutely essential to have data sharing between the different ministries in this One Health capacity, so that we are all working together, we are looking at the same information, and we are acting upon this information by drawing it from all these different sources. So now, nearing the last few slides of this presentation, moving on to how rabies elimination efforts strengthen overall health systems. So I've touched on how rabies can operationalize One Health, how it is essential to rabies control and elimination efforts, but also how rabies can really bring together all these different partners and all these different ministries so that they can work together in this One Health manner. But now we're going to look at how this all works to strengthen overall health systems, how rabies control and elimination can potentially support other disease interventions. So how can we prevent future pandemics by delivering rabies control and elimination programs? So we know that rabies elimination efforts builds capacity, and part of that is, of course, as I've presented throughout this presentation, the operationalization of One Health. So to have already in place One Health task forces who are used to working together, who are used to sharing information and sharing data and coordinating with one another, sharing resources. If that is already in place for rabies, then it's extremely easy to include other diseases or other health challenges into that task force or into that working group to then deliver it for other diseases. Looking at education as an example, there's a publication comparing or analyzing the potential for snake bites, envenomation, and rabies to partner and work together. And if we look at snake bites and prevention of snake bites and dog bites, there's very clear and very similar education messages between these two different diseases in terms of bite prevention, in terms of standing still and avoiding bites, and then what to do if you are bitten. These messages are extremely similar, with only minor tweaks needed to adapt it to an entirely new disease. And if you have the capacity to go out into the communities already, you have your trained experts and professionals who can go out and educate the community about this information, then that is half the battle won already. As I mentioned, disease surveillance is absolutely critical. And if we put in place strong disease surveillance systems for rabies in terms of sample collection, identifying cases in the community, reporting this information, capturing and analyzing the data associated with that, if you have the infrastructure, you have the computers, the systems, the community health workers working in the field in place for rabies, then again, it's very easy to add on additional diseases that builds upon that capacity, and then we can address a very clear One Health surveillance system for multiple other diseases. Similarly, with laboratory capacity, if you have the equipment in place, you have the trained staff, again, it is very easy to then add on additional diseases or aspects that need to be addressed so that it goes far beyond just rabies. Professional training, similarly, if you have the structures, the protocols, the training in place for rabies professionals, especially in terms of investigations, performing investigations, early case detection, understanding how to use your surveillance systems, and understanding the different procedures required for rabies control and elimination. Again, it is very easy to then expand this and extrapolate that for other diseases. And of course, one last example, but there are many, many more, is looking at your cold chain and logistics. We know we need to keep the vaccines cold and stable so that they can be effective when we deliver it during mass dog vaccination campaigns, to ensure that people who go to different clinics, even in extremely rural areas, have access to vaccine and the post-exposure prophylaxis. And so if that is all put in place for rabies, that can be equally as effective for blood donations, for many other diseases and conditions. And so we know that there are essential skills and capacity that is easily transferred for implementation by other diseases with only minor modifications required. So coming to some of the conclusions, we know that rabies presents, and we can see hopefully from this presentation that rabies presents as the ideal candidate disease to operationalize One Health. And together we can achieve the goal of 0 dog-mediated human rabies deaths by 2030. This is actually a quote from PAHO during World Rabies Day in 2021. And we know that it can be done if we do work together and if we do operationalize One Health. And lastly, by delivering effective rabies elimination programs, we not only save human and animal lives from rabies, but we also help to develop the capacity and strengthen health systems so that we can prevent other diseases and hopefully prevent future pandemics. So I'd like to thank you very much for your attention. If you have any questions, please post them in the questions pane and we'll address them as best we can. Thank you very much for your attention, and I look forward to seeing the questions.
That was a wonderful presentation, Dr. Terence. Thank you so much for that. Hello, everybody. This is Aryan Patki from IVSA India Exco, and I'm here to moderate this particular segment, your interaction, the audience's interaction with Dr. Terence. So, Dr. Terence, thank you so much again for your valuable insights. Your presentation was so detailed and so informative, and you managed to capture this event and our audience really well. So now we are opening the floor to the audience questions. So everybody who has questions can put them in the Q&A box. Thank you. So Dr. Terence, before we move on to the question that has been put here, and while we give our audience the time to put in questions, I'd like to ask you a little bit about your journey, about where you studied from and what degree you pursued. So could you please shed a little light on that? Thank you.
Thank you. Yes. So I was born and raised in South Africa, and I did my university degree in South Africa at the University of Pretoria. I studied there throughout, starting from my undergraduate on BSc, and moved on to my honors, master's, and PhD at the University of Pretoria. And then through that, I became involved with the Global Alliance for Rabies Control and have continued with the Global Alliance for Rabies Control.
All right. Thank you so much for answering that, Dr. Terence.
So I see there is one question from Dr. Kenneth Chawinga from Zambia. The question is, seeing the high percentage of human deaths due to rabies, what are the interventions the local and central governments of India have put in place? Does government conduct mass dog vaccination against rabies? And does the government provide post-exposure prophylaxis for free? And is this readily available to citizens? So I see some of those aspects have been responded to in the chat box, but I think this is a question that is worth highlighting a little bit further. Mohana, would you like to jump in and respond to that question a little bit? So I see that you have added an answer in the questions pane, but it would be nice just to address that for the rest of the audience too.
Hello, everyone. Once again, I'm just trying to open the questions pane. Okay, I see that my camera is working now. Okay, yes. So with regards to the situation in India, as I've mentioned in the chat box, that the government has an ABC, which is Animal Birth Control Program for stray animals, especially dogs, since 2001. But sadly, the rate of sterilization operations being carried out versus the size of the population of stray animals, which is already existing, there's a large discrepancy between that, due to which the number of dogs are increasing despite there being such a program in place. And also there, as you'd know, India is a very large country, and there are a lot of rural areas where maybe the government policies are not so strongly effective as in where the in urban areas as well. So then in those areas, there are still problems of a lot of stray animals on the road, especially where they form packs of dogs and keep barking throughout the night, or especially when there is such a large population of dogs, there's usually the concern for food shortage. As I have like roughly read the concept of one welfare and one health, and how both go hand in hand as well. So to shed a little light about one welfare is the concept of welfare for the humans, animals, as well as the environment, same as how we go about with one health for one welfare as well. So in that case, it becomes a welfare issue as well to have so many stray dogs on the road. The government, coming back to your question, the government is, however, trying to tackle that. But since it is also a developing country, the shortage of funds and allocation of funds for this particular program in the country is not enough or adequate, as I would say, and also the large increasing population which continues to increase. To answer your question about the vaccinations for humans, they are available at minimal cost at government hospitals for humans to take prophylactic, as well as post-exposure vaccines. They are available for a very minimal cost of like 100 Indian rupees, which must be just a few cents. And then the final part about yeah, I think that was it. Mass vaccination is not done so much. It's more focusing on the ABC birth control program. But there are many NGOs who try to conduct these mass vaccination camps and different kinds of activities. So those are more effective over here in urban areas, especially all the NGOs. Thank you very much. Over to Dr. Terence.
Thanks. And just to add on to that, so as many of you would be aware, India released its national strategy for rabies control and elimination. If I remember correctly, it was World Rabies Day 2021, where they released their national strategy, and that was based on the stepwise approach towards rabies elimination. And with the national strategy, they are obviously looking to implement that in terms of mass dog vaccination campaigns, improving post-exposure prophylaxis, addressing dog population management challenges, and all of that is addressed in the national strategy. There are many government-led mass dog vaccination campaigns in the different states, but because India is a federal system that has individual states, it is a little bit more challenging because each state is responsible for their own particular rabies elimination efforts. Just touching again on what Mohana mentioned, there is post-exposure prophylaxis available in many clinics around the entire country in India. It is widely available, and a lot of it is provided to humans, but it does come at a cost. In many instances, it is subsidized, but it is not entirely free. So I hope that addresses the question in sufficient detail. If you have any follow-on questions on that, or if there are any other questions, please feel free to add that into the chat.
All right. Thank you so much, Mona and Dr. Terence, for answering that question. That was very informative. So, Dr. Terence, we do have one question for you. Somebody has asked, how does one become a member of the GARC?
Yes, thank you. So that is, you're welcome to volunteer for the Global Alliance for Rabies Control. You can see on our website there is a Get Involved tab where you can then volunteer. Otherwise, you can simply contact us through our email address at support@rabiesalliance.org, and I'll put that email address into the chat. And we welcome any person to get involved, to volunteer. I think one of the main and best ways to get involved with rabies elimination activities and with GARC is to participate in World Rabies Day. So to host your World Rabies Day event every year. The event registrations are open already, and so you can start preparing and registering events to then add your voice to the global voice to drive rabies elimination around the world.
Thank you so much, Dr. Terence. That's wonderful. I think it's a great honor to be volunteering at such an organization also. So I hope you have your answer. Thank you. There is one question about related to the transmission. Is rabies transmitted by eating and drinking raw milk and meat?
So from what I can remember, I can double check in the WHO's technical reports, but there have been no cases recorded from eating raw meat or drinking raw milk in rabies. However, the WHO still considers this as a risk for rabies, and therefore you should still seek post-exposure prophylaxis and let a medical professional determine whether it is required that you receive post-exposure prophylaxis from this as a potential exposure. So we know that it's obviously not advised, but there is no evidence that this results in exposure. And from drinking raw milk alone, post-exposure prophylaxis is not advised. And obviously, if it has been pasteurized, then that presents no risk. But eating raw meat is, of course, a potential risk, mainly in terms of, and especially from people who may butcher those animals and then be exposed to it. So it is very dependent on the situation, but in drinking raw milk, it is not a risk for rabies, but eating raw meat or eating any meat from a suspect rabbit or a confirmed rabbit animal is a potential risk, and you should seek post-exposure prophylaxis or at least advice from a medical professional to guide you on the post-exposure prophylaxis.
All right. Thank you so much for answering that. Another question that we've received is, currently, are there any institutions working on making rabies vaccine which can induce permanent immunity to the disease?
So permanent immunity is a difficult caveat in that question. So there are many, many different vaccine manufacturers around the world who develop and produce extremely effective both human and animal rabies vaccines. There are, of course, unfortunately, some manufacturers who produce lower quality vaccines, and therefore it is important to rely on the international guidelines and recommendations from the WHO and from the WOA in terms of identifying highly effective and safe vaccines. In terms of the development of permanent vaccines, in many instances there have been a lot of studies in human rabies vaccines where the immunity after your first booster is extremely long lasting, but it is still recommended that your titer is checked every 3 years. So if you are regularly working with the disease, or if you are in contact or potential contact, your titer should be checked every 3 years. So to my knowledge, there is no vaccine available at present that is lifelong. Again, depending on your definition of lifelong, because in many rabies endemic countries, as an example, if we look at animals, you can vaccinate an animal. Many of the high quality vaccines provide adequate protection for up to 3 years. And in many of these rabies endemic countries, some animals do not live beyond 3 years of age. And so in theory, that could be lifelong vaccination. So there are many different caveats to that response. But I think in terms of human rabies vaccine, there is no one-shot silver bullet vaccine yet.
Okay. Thank you so much for answering that. There is another question that I'm reading out to you now. What do you think about oral weight vaccines?
So oral bait vaccines are extremely effective. They have been used very effectively to eliminate the disease in wildlife populations, especially throughout Europe, where it is entirely rabies-free. There have been huge oral bait vaccine drops in the US to help control rabies in wildlife in the US also. So they are extremely effective. We know that they work. We know that they are safe. And there have been a lot of new developments in terms of oral bait vaccines for use in dogs also to help supplement your parental dog vaccination programs. So because of the cost and the logistics and a lot of the other factors around oral bait vaccines, it is at present not recommended that they are used only in terms of dog vaccination campaign, but rather as a supplement to reach those difficult to reach animals when you are undertaking your standard parental or using needle and syringe vaccination campaigns. So they are very effective. There have been a lot of studies quite recently. A lot more evidence has come through about that they are extremely effective, that they work really well, that they are easy to deliver, especially to reach those hard to reach dogs, and therefore they're excellent to use, I'd say.
Okay, thank you so much for going over that part actually, because as a student myself, and I'm sure many people here who just know about rabies in cats and dogs, it's definitely nice to know that there is something different in wild animals, and we definitely love to know more about the developments. So thank you for going over that part. Our next question is, what is the most correct way to deal with a rabid dog patient brought to a clinic? What protocol should the vet follow from the start till the end?
So I believe that this would be a rabid dog that is brought to a animal health clinic. So if an animal is rabid, if it is showing all the signs, and if it meets the case definition for rabies either in your country or the WOA case definition, so the World Organization for Animal Health, depending on whichever is used in your country, usually each country has their own case definition. So if the animal meets that case definition as a suspect animal, it should be immediately euthanized humanely, and then a sample should be taken and sent to the laboratory. And of course, because it is a notifiable disease, it should be notified to the relative authorities.
Okay, thank you. That is definitely one of the most important things that we as vet students in the clinic should know. So thank you so much for letting us know that. We have one more question. Does rabies spread to pigs and ruminants?
Yes, so rabies affects any mammal, so any warm-blooded animal, including pigs, including ruminants, so cows, giraffes, any warm-blooded animal can be affected with rabies. The difference is that in most instances, other mammals are what we call dead-end hosts. So they will get the disease and they will definitely die from it, of course, but they are unlikely or less likely to pass that on to other animals. So a dog is a reservoir. It means that it can transmit the disease to other animals, to other dogs, and maintain the cycle within that population. But in terms of pigs, in terms of cattle, as an example, it is unlikely that it will pass on rabies to other cows, to other pigs, to other animals. And so that animal will die from the disease, but it will not maintain the disease.
Right. Thank you. Thank you so much. I think I just see one more question in the question answer box. Somebody was asking if you could share the presentation with us for awareness purposes and knowledge purposes.
Yes, so this webinar is being recorded and we will share it with you. We will also post it on our YouTube channel. And I'm sure the IVSA India will also share that and have it available to share with anyone interested. So you're welcome to either reach out to us. It will also be shared through a follow-up email that you receive in a day's time after this webinar, so tomorrow. And we will also then post it on our own YouTube, on the Global Alliance for Rabies Control YouTube channel, and it will also be available through IVSA India. So yes, certainly you will have full access to all of the information shared on this webinar.
Thank you, Dr. Terence. That actually is a good news because your presentation, like I said before, was really detailed and wonderful. And it's going to help a lot of us understand the perspectives around rabies and One Health, because you definitely included almost everything, like what is One Health, its challenges in implementing it, and the ways we could. So that's a really wonderful thing. Thank you so much. And I think that was the last question. Thank you so much for answering our members' questions so patiently. Firstly, like I said, the content was delivered so beautifully, and now the Q&A section has definitely answered a lot of questions that were there in our minds. So thank you so much, Dr. Terence. I would like to ask you if you have any final conclusion or any message for our attendees from your side.
No, I think I would just like to thank everyone for their participation. I know this isn't the end of the webinar yet. We've got a few more things to wrap up with, but I'd like to thank everyone for their participation. And if you ever have any additional questions or concerns about rabies, please feel free to visit our website. Please feel free to reach out to us at the Global Alliance for Rabies Control, and we'll assist you wherever possible. And I'd certainly encourage you to undertake our free online education courses. I'll post the links of that into the chat, and to participate in World Rabies Day this year. So September 28th is World Rabies Day, and we look forward to seeing lots of events of people working together in a One Health way to drive rabies elimination around the world. So thank you very much for your time, and thank you, Ariane and the IVSA India team, for your help, your participation, and for leading this webinar today.
Thank you, Dr. Terence. Moving on, next thing that I'm going to be talking about is our scientific essay writing competition that has been organized by IVSA India and the GARC. So I'd just take a minute to share my screen. All right. So as you may all know, IVSA India and the GARC are collaborating to create a coveted opportunity for the students of IVSA India to research, develop scientific writing skills, and showcase their technical opinions on rabies and One Health. So as you can see, the topic for our essay competition is the role of One Health in rabies elimination efforts at a community level. So just to talk a little more about the topic, we all really do understand the meaning of One Health theoretically, but the question is, how much do we understand it when it comes to operationalizing it or putting it into practice or implementing it practically? So all that has been covered by Dr. Terence in his talk, but this is what our the essay writing competition is about. So the human health sector mainly focuses on human health, and the same is true for the animal health sector. But I think we all have understood by now that all we really need is the joint efforts of the human and animal health sectors to combat serious zoonoses like rabies. So there is irrefutable proof that if we eliminate the disease in animals, there will no longer be any human cases in the world. So rabies, like Dr. Terence mentioned, is an excellent example of a disease to operationalize One Health. As over decades of putting the concept into practice, it has demonstrated clear and tangible progress. So, like talking about the essay writing competition, here are a few instructions for participants. So what you need to do is provide us a clear, concise investigation into implementing One Health joint efforts practically at a local level with out-of-the-box ideas and research. And do remember that the example of rabies epidemiological study must be incorporated in explaining One Health strategies in your essay. The other the other rules are given in the picture that I'm displaying, the length, font, etc. And you may also give it an impactful title, definitely, to make your essay more powerful. And you also can add one image in relation to the substance of the essay, but that is optional again. And I think I really urge all of you guys, all of IVSA India members who are present here, to definitely participate and write this essay and submit it to us, because having attended this webinar, I'm sure you have a much wider perspective about One Health and rabies and everything that this essay demands from you. And of course, at the end of the day, there are exciting prizes that you can win. So first of all, you're going to receive, all the participants would be receiving GRC certificates. And the best part is that you are going to have your work recognized and evaluated by the international stakeholder. So as students also, you're going to get to learn a lot, and plus your work will be evaluated by an international organization. And the top 3 winning essays will receive exciting prizes from IVSA India. And the winning essays shall be published by the GARC on their website and the official newsletter publication. So this last point, I'm sure, is very exciting to everyone, and it's such an honorable thing to have your work published in a newsletter and on the website of an amazing international organization, because especially at an undergraduate level. So this would definitely look amazing on your resume, and I'm sure you as an individual will also feel proud. So definitely do opt for this. Definitely write the essay. And now you know many points that Dr. Terence has covered in his talk. So I'm sure you're going to have an upper hand over a lot of people who have missed the webinar. So that is what I wanted to talk about. Thank you so much for listening to me. Shall stop presenting. Yeah.
I hope everyone from the attendees is really inspired by Dr. Terence's talk and presentation. He basically gave you the whole guideline of what are good points to include in your essay if you were to participate in this competition, and also gave a very wonderful learning for yourself as a vet student and also as a One Health enthusiast to remember for your whole life. So I really hope everyone over here will make an attempt to participate in the essay competition, and we look forward to reading all your responses. The deadline is the 31st of May. So I hope you have already started writing your essays and are at the stage of adding some touch-ups after listening to Dr. Terence's wonderful presentation. Or it's not too late, even if you have not started yet, you still have 2 weeks to go to submit your essays. So if you have not, and if you're feeling extremely inspired by our webinar over here, then please do go ahead and participate in our collaborative competition. Look forward to seeing your entries. And I now hand over the platform once again to Dr. Terence to promote the wonderful REC, Rabies Educator Certificate course by the GRC.
Thanks very much, Mana. And I'm going to just take 1 or 2 seconds of your time just to say that if you want to learn more about rabies, you can undertake our free online self-paced education courses. The foundational course being the Rabies Educator Certificate. So it will touch on many of the different aspects that I spoke about today, as well as empower you to become a person who can go out and educate other people about the disease. So we really encourage you to undertake that course. I've posted the link in the chat, and you can also find it on our website. So thank you very much, and I look forward to seeing a lot more REC graduates in the near future. If there are any questions or if there's anything else, sorry. If there are any questions or anything else, please pop it into the chat, and over to you, Mahana.
No, definitely. If there are any questions regarding the REC course, please relay them over to Dr. Terence to answer. It's a very, very interesting opportunity and also free of cost educational opportunity for all students around the world. So definitely check that out on the website after this webinar, as well as the essay competition as we talked about earlier. So keeping all these wonderful things in mind, we now come to the end of our collaborative webinar of IVSA India and the GRC. And on behalf of the whole team of IVSA IVSA India, we really thank you all for staying till the end. And this is a really proud moment for us because IVSA India is now coming to the end of this particular term in the month of July. And this was one of the big events that we have been planning since a long time, and to have it materialize just before our term end, as well as to go into this really great partnership with the GARC, it is really very, very amazing opportunity for our whole association. So for my vote of thanks, I would like to thank Dr. Terence for always being so supportive of our organization. He's the one who's always coordinating via email and always so supportive of students and whatever ideas we approach him with for different events, webinars, and all the amazing collaborations that we have planned in this particular year with the GARC. And I would also like to thank Mr. Kim Doyle and Ms. Kerenza from the GARC as well, who has been a pleasure really to coordinate with and to have this partnership materialize because of them. And on behalf of IVSA India, we'd like to thank all the participants and also the whole Exco of IVSA India in making the questionnaire survey, as well as helping me with my presentation, doing the moderation for this event, and all the different things which went into making this webinar happen. So thank you so much, everyone. And over to you, Dr. Terence, to say a last few words before we conclude the amazing event.
Thank you very much, and thank you to all the participants. Thank you to the IVSA India team, especially Mahana, for all the coordination, and we look forward to hearing from all of you soon, and we look forward to all the SA competition entrants. Unfortunately, the SA competition is only open to IVSA India members for those of you who are joining from other places around the world, but you are still welcome to get involved with rabies control and elimination. So thank you all for your time. Thank you for taking the time on this Saturday, and we look forward to seeing all of you in future events. Thank you and bye-bye.